Muscle changes with age. Hi, it's me, Maria Fichuk, a dermatologist and anti-aging medicine specialist. And today we discuss what happens with our muscles, with our facial muscles with age. First, we need to understand facial muscles are totally different from body muscles because body muscles, they have fascia, which surround the muscle. Facial structures, facial muscles, they are totally different. They do not have fascia except two major muscles. The big chewing muscle, which is called masseter, and the temporalis muscle, which also has like fascia on top. But just those two muscles, that's it. But we need to understand that the other muscles on the face, they are completely different. They do not have any fascia. And they have just one side, they insert the bone. So they start from the bone. And the other part of the muscle inserts into the skin. And while contracting, because of being inserted to the skin, so being attached to the skin, these muscle movements create some folding in the skin. And when our skin becomes more photo damaged, becomes more chrono damaged, and we have already discussed all these things in the previous videos, it means that the skin becomes less resistant to physical damage and it becomes more wrinkled, and we can obtain the wrinkles that are perpendicular to the muscle contraction vector. It means when it starts to contract, the wrinkle become to appear being perpendicular to this vector. So what does it mean? When our frontal muscle, when our forehead muscle, which starts on the bone and inserts the skin, and it begins here and ends here. The frontal muscle, it's called in Latin frontalis muscle. So this muscle, the vector of the contraction is vertical, but the wrinkles which appear, they become horizontal. So the horizontal lines on the forehead, they actually start to be formed because of this muscular contraction. The vertical wrinkles on the forehead, they become visible because of the contraction of eyebrows muscle, and they become contracted. The vector is more horizontal. That's why the wrinkles are vertical. At the same time, all the muscles in the face, they are divided in two groups. They can be levators, so they can lift the structures up, and they can be, unfortunately, depressors, so they help to lower everything down. And all together, all this process together creates a specific muscular activity on our face. And as well, we have two circular muscles. One circular muscle is orbicularis oculi muscle, so the circular muscle of our eyes. And the other circular muscle is our perioral muscle, orbicularis oris muscle in Latin, orbicularis oculi muscle and orbicularis oris muscle. So the contraction is like this. They are circular. So the wrinkles are formed and they are perpendicular. If the contraction is like this, so the wrinkles are perpendicular. So several wrinkles can be formed perpendicularly to the muscular contraction, as well as the crow's feet, because the muscle contracts circular, so the wrinkles start to form like that because of the muscle structure. So what happens with aging? There are several very, very distant hyper toned muscles. We have hypertonic orbicularis oculi muscle, and if we think about our smile when we were 15, when we were smiling, our eyes were more open, they were wider. At the same time, when we get more mature, wiser, when we're 30 or 35 or 40 already, we definitely can see that while smiling, our eyes, they get smaller because of this muscular movement, because this muscle becomes stronger. It contracts so many thousand times a day, and the skin becomes damaged, becomes thinner, and that's why it's not so resistant to muscle movements, and we lose the fat tissue as well. So in order to understand that, we need to think about the other hypertonic muscle, which is a depressor anguli oris muscle. So it tilts our mouth corners down. Sometimes we have the neck muscles more hypertoned, more contracted, and we can even observe some like toned lines of the muscle movements here in the face, in the neck, and probably it's more beneficial for this patient to have more relaxation on the neck so that other muscles would work harder. Our muscles on the face, they are very, very interesting. They are team players. It's like when one muscle on the face is more relaxed, the other group of muscles, neighbor muscles, they try to take some work from the relaxed muscle onto them. For example, if we relax one group of muscle, the other group of muscle, neighbor muscle, become more toned. And we can work with muscles in two ways. First, we definitely can work with a botulinum toxin, for example, with Botox, right? And we work with the Botox in order to receive specific relaxation of the muscles. And when we create the temporary relaxation of the muscle activity, we can create more active neighbor muscles. For example, if we relax the medial part of the forehead, the lateral part, the side part of the forehead becomes more lifted and elevated, and that's how we can elevate the eyebrows. When we relax a little bit of lowering muscles of the eyebrows, if we relax this part with botulinum toxin, we have more open and wider look, open and brow lift look, because of the team work of our muscles. Or when we relax the lower part of the face with botulinum toxin, we can reshape the muscular activity here in the medial part of the face, and we have the muscle structure here which help to form the smile, and all the muscles here, they lift everything up. So we can work with a botulinum toxin, with botulinum therapy, but there is another possibility. And around like 10-12 years ago, I figured out that while creating the full face remodeling and restructuring of my patients, I see that, for example, working with chin and creating the specific work here and different layers, while relaxing this area, I can help the muscle movements to be more lifted in the medial part. Or when working with temporal area, I can open the forehead and then I can open the look as well because of the teamwork of our facial muscles. And at the same time, it depends where we put the filler. It can help the muscle to work, or probably it can create like amortization, so to create like a small breakage, and muscles, they become more relaxed. For example, while restructuring the mid-face with, for example, Juvederm Voluma, we can elevate and open our smile. We can elevate the structures on the face, and we can create the elevated, lifted look. Because in order to create the lifting of the lower face, we need to work with the mid-face first because of the muscular and ligament structure there. So that's just anatomy. So in order to understand what are actually the muscles in the face, we need to remember that they create this mimic, these facial movements because of the contraction. So one part on the bone and the other part in the skin. And the wrinkles are formed being perpendicular. So we can work with the muscles, with botulinum toxin, we can work with hyaluronic acid fillers, and at the same time improving the skin quality. We can definitely help we can help the skin to be more resistant to muscle contraction and muscle creating of wrinkles. So this is the secret for muscles, and how we can transform it area by area in my next videos. Please subscribe.